spring. You might have already started experiencing those allergy symptoms, runny nose, itchy eyes, and sneezing. Yeah, that means spring is here. And if you have asthma or another respiratory concern, you'll likely start feeling worse this season. For more about allergy complications, we're joined by Dr. Denitza Blagev, a pulmonologist with Intermountain Medical Center. Thanks for being here.
Thank you for having me.
So I remember reading before we got into spring that this was going to be an especially rough allergy season. What are some of those things that are causing our allergies to spark up now?
So typical allergens, especially in the spring, would be tree pollen, and then there's other trees and grasses and weeds. And we experienced this especially warm winter, so a lot of those are starting up earlier. We've seen a lot of the trees and flowers blooming.
So we might have not only a worse off allergy season, but a much longer one.
That's right.
This year.
That's right.
You mentioned grass, and I don't know if a lot of people think of grass when they think about allergies. That plays an important role?
That's right. So grass is more of a summertime allergy rather than the spring, but often, most of my patients that I'll see that complain of allergies are people with asthma or other respiratory conditions, and they'll complain about worsening symptoms when they mow the grass or with grass exposure.
Yeah, because it just kicks everything up.
Yeah.
So you mentioned patients with asthma. They already have a respiratory concern. This just kind of gets right on top of that and makes it worse.
Exactly. So allergies themselves are quite common, and up to a third of people that have allergies will actually also have asthma. So one of the common things that causes allergies and asthma is kind of this autoimmune sensitization. So people who have asthma, allergies would be a common trigger to make their asthma worse and cause more shortness of breath or cough.
It just sounds lovely, doesn't it? What can they do when they start noticing those symptoms and having more complications?
So one of the main things for asthma is to really try to avoid triggers, which, for people that are allergic to their cats or dogs, that can be an issue. If you're outside and it's high pollen season, there's a limit to how much we can really do. And so some of the treatments would be symptomatic treatment of the allergies. So there's the over-the-counter antihistamines that people can take, or some of the nose sprays that can decrease the allergies. Some of the post-nasal dripping down can really irritate the airways and contribute to that cough and asthma inflammation. And then in terms of the asthma, just making sure they're taking their inhalers the way they're supposed to and their medications for their asthma, taking that extra rescue inhaler as they need it, and making sure they talk to their doctor. If their symptoms are really not well controlled, they may need to escalate therapy if needed during those particular times of year.
At what point does someone who doesn't think they have asthma and they're starting to notice all of these allergy symptoms, at what point do they stop with the over-the-counter medications and go see you or a doctor about it?
So in terms of allergies, the common things that'll be watery, runny eyes or itchy eyes, runny nose, that kind of thing. But if they're really developing symptoms of cough, and in particular cough, wheezing, shortness of breath, or they're noticing that they're limiting their activities based on cough or wheezing, then that would be a time to think about asthma in addition to allergies, and then trying to treat that.
And maybe a good time to call Dr. Blagev. Dr. Blagev, thanks for joining us.
Thanks for having me.
We'll put those details on our website at goodforutah.com. You can see the link there to Intermountain Medical Center. We're all waiting for what experts call